Hi, I'm Dr. Ivan Valkaringi. Today's topic is about sleep apnea. It's a serious healthcare crisis. It's estimated that 40 million people suffer from sleep apnea, uh, and especially over the road drivers, truck drivers, bus drivers. Imagine if they are driving with their eyes open but are essentially asleep. They're driving a weapon that can harm people. And so sleep apnea also has cardiovascular events, and it affects almost every organ system in your body. If you're not getting adequate oxygen or sleep, you're affecting every organ in your body, even your skin. You become more diabetic resistant or insulin resistant. There's just a cascade of health problems when you're not getting the rest and the refurbishment your body needs. So there's two things that happens in sleep apnea. One is you have upper airway obstruction, so you don't get the oxygen that you need, and so your cognitive abilities could be affected as well. I had a dental assistant who once worked for me who, before we got her tested, would her eyes were open, she was working chairside, but she just wasn't getting things and wasn't reacting properly. And this was in the early days when we didn't know that much about sleep apnea. So we got her tested and found out she had something like 70 interruptions per hour. At that time, we talked about interruptions rather than apnea and hypopnea. And once she got treated with the CPAP machine, night and day was the difference. She would come to work and now she was more focused. And I was so happy because I was seriously considering about letting her go. But she turned out to be a great worker for us. So sleep apnea is a problem that is a medical problem that has medical consequences. Your physician, and unfortunately, not a lot of physicians still know that there's dentists who can provide oral appliances for treatment. And oral appliances are well tolerated and proven to work, especially for mild and moderate sleep apnea sufferers. About 75% of people can be helped with oral appliances. The percentage goes down for people with severe sleep apnea, it goes down to about 50%. But amazingly, many severe apneics are coming in for oral appliances as well because their physician would rather have them treated somewhat than not at all. And patients just refuse to use the CPAP. We have a small percentage of people that like the CPAP, and it works. There's no doubt about it. It's very effective in treating your disease, and if that's all there was to treat your disease, I would absolutely use it. As you know, there's some celebrities that have passed away because of sleep apnea. Carrie Fisher, the late Judge Scalia, Reggie White, the football player. So there's many more out there that we didn't identify as sleep apnea, but it can definitely kill you. And I was talking about this with a patient one day, and in the next room was another patient who said, Dr. Ivan, I have a horror story like that you're describing of what could happen if you had untreated sleep apnea. My nephew died at 32 years of age when he went to take a nap on the couch. So sleep apnea, it can be fatal. It's a small percentage, but nevertheless, it's a serious consequence. So we encourage people to talk to your physicians about oral appliances. Most sleep physicians know about oral appliances. The dentist is part of the sleep team now. Sleep MDs only amount to about 6,000 of them in the country out of over 1 million doctors. So there's still a lot more education that needs to be done in the medical and dental fields. There's only 600 diplomats in dentistry, and so the word is getting out, but it's slowly getting out. We need to do more education, and as people discover that they can wear a very tolerant and are very tolerant of these oral appliances, I think you'll find that more and more people will seek out this as their treatment for sleep apnea. If you have any questions, please don't hesitate to call us. You can contact me at Midwest Dental Sleep Centers. We have 5 centers here in Chicago, and I'm happy to answer any questions by email as well. You can contact me at Dr. Ivan at MidwestDentalSleepCenter.com. Have a great day.